socio-economic component of the research programme. And this presentation is based on a conference paper that I've prepared and will be presenting in Poland in June. And the full paper will be available on the UE Open repository after that event. But I'm just going to hopefully talk about the way that the rationale for doing this research, and I'm hoping that this is going to launch in a minute. Do I have to launch this, Catherine? Doesn't appear to be moving. Okay, so the content of this presentation, I'm going to start with an introduction, talk about a little bit more about the Flood Memory Project. I'm going to talk about the rationale for this particular part of the Work Package 5, the study on mental health impacts in repeat flooding. Touch on the methodology that we used, and really try and focus on the findings and implications of the work, and then briefly touch upon what the summary of this particular part of the study and the next steps within the project will be. And as I said, this study is part of the work for WP5 socio-economic aspect of repeat flooding and flood memory. So the Flood Memory Project as a whole examines clustering of floods from weather events through the physical systems that translate those weather events into hazard events, and those hazard events cluster in time, right through to the impact of repeated flooding on humans, the built environment, and natural systems. And just for clarity, to think about what we mean by memory, I've put up here a working definition of flood memory, which could stand across much of the project, but in this particular case, I put the blue highlighted sections in to talk about the mental health and socio-economic aspects. So here I'm saying that memory is not just about what people remember, but it refers to things which are stored within the socio-economic, ecological, and physical system. So memory refers to differential level of vulnerability, in this case to mental health problems, which is caused by the effects being held in the system of the previous damage from previous flooding, and the limited window of time that there is to recover between events in areas where there is clustering and frequent events. And there are many different things we could have considered here, and we will be considering other aspects of the socio-economic landscape that are impacted by memory and repeat flooding. So why specifically mental health? I think it's a very important aspect of the socio-economic landscape to consider, and particularly using the lens of memory to consider it. So there's been quite a lot of work around health and flooding in the past, and in the developed world, at least, we've become quite skilled in overcoming some of the physical impacts of flooding, deaths and diseases. And there's a consensus that mental health issues are now one of the major health impacts of flooding in the developed and the developing world. Studies, for example, Caroland and Futrell have looked at this broadly across health and concluded that mental health problems are very great. Experts such as the Health Protection Agency in the form of STANC have called for more research in the field of mental health. And specifically, that there needs to be a very wide spectrum of research looking at mental health issues to provide support to responders, to agencies and professionals as to how they can mitigate against the impact of mental health in trauma in general, but in flooding in specifically. And having a look at this wide spectrum of research that needs to be done, what we're doing in Work Package 5 specifically is trying to understand the role of memory in mental health issues. And this, we feel, may help in recovery processes and better mental health outcomes following flooding. And this is an area of research which is very close to the heart of the research within the Centre for Floods, Communities and Resilience. It follows on from previous research in recovery by Sam Winger Proverbs and Homans, which really discovered that many flood recovery professionals are acting frequently as unofficial counsellors, support network to people who have been flooded and are in the recovery process. There's very little guidance or support for them in how they could do this in ways that will help to improve mental health outcomes. It's quite clear that although mental health professionals also need guidance in this area, it can't be the sole responsibility of healthcare professionals to support everybody during the recovery process to improve mental health outcomes. Better mental health outcomes could lead to more resilient communities in the future. And this is very important in the policy landscape in the UK, where we are recognising that we have to make space for water and that we have to live with floods. And living with floods is one of the stressor variables which we'll come back to later. And so with this kind of policy landscape, it's very important that we consider floods will happen, and we need to be able to support people who live in frequently flooded communities to minimise the impact of that policy landscape. It's also very important, now I seem to have next. It's also very important, given that within the centre we are not psychiatrists, we're not mental health professionals, that we choose the right research techniques and approach, that we're not going to be being too intrusive, and that we choose an ethical approach to looking at mental health issues. And so initially we've taken an inquiry-based qualitative approach, which is to look at a review of what literature is already out there in order to focus any empirical research we do really down to the absolute essentials and the least obtrusive that we can be. Okay, so the review of literature was designed to answer these 3 questions, which I've got up there. And those 3 questions were designed to answer the aim of the study, which is to look at how responders and recovery professionals can help in between repeat flooding events towards better mental health outcomes. And so those 3 questions start very basically with what are the mental health problems caused by flooding, what factors affect the prevalence and severity of mental health in flooded communities, and then go on to what is really the novel aspect of this particular study, which is how long do those mental health aspects endure, and does the memory of flooding affect the mental health outcomes following flooding, and how can that affect the way that recovery professionals advise, counsel and support flooded communities. So there were over 80 studies directly picked up by this review of literature, and they covered a vast array of literature, including epidemiology, disaster studies, flood studies, but they also included several overarching reviews, including Tapsell, Pew, etc. And so the actual number of studies which have been included in this information is much greater. The research doesn't just cover flooding, because it's important that trauma studies have been carried out for other natural disasters and man-made disasters. So there is an element of general disaster and trauma studies in here as well as flood specific. I'll try and be clear which is which as we go through. So a key author in this area, Norris et al., have looked at numerous disaster studies over many decades, and multiple older studies looking at disasters in general, but also flooding specifically. And they report that PTSD, depression and anxiety are the most frequently reported mental health issues following flooding, but also that the spectrum of mental health issues is very broad. Now, this illustration from a disaster website shows it quite graphically. So examples of mild reactions from insomnia, which many or most people experience after a trauma, going through to the severe reactions such as PTSD and depression. Fewer people suffering from these, but they are much more severe. Norris found a spectrum of reactions from anxiety to PTSD, but even reported some positive developmental aspects after disaster, where particular levels of support or actions have given people positive feelings of empowerment. So you might see the mental health aspects going from positive right through to the most negative PTSD and depression aspects. That's general. That was general disasters. A recent review which covered flooding specifically is shown next, and this is Alderman et al. 2012, I think. And they looked at flood studies across the globe, and what's very clear when you examine these results, summarised here, is that there is a very wide range of different levels of suffering after a flood. From, if we look at this example in China, PTSD rates of 8.6%, 2.5 years after the flood, right up to mild depression, 53.5% in Korea. If you look within studies of English floods, and I think this Mason study was probably studying the 2007 flood, although it doesn't say, even with those two studies fairly similar in aspect, 3 to 6 months or 6 months post-flood, very different levels of mental health issues are observed. And there's quite a lot of reasons why this might be. Distance from the flood is one, severity of the flood, methodology. It's complicated by lots of things like the measurement of the underlying level of mental health disorders in the population. So what does this show us? It shows us that there is a wide variety and that it's actually worth thinking about unpicking some of the influencing factors. It shows us that it's not going to be possible to take existing research and make predictions of the need in future from flood events. Okay, so moving on from that to the second question, which is about what are the influencing factors. I said it was worth unpicking those. Just a couple of interesting models here that came out of the literature. A model by Few et al., which is a generic health model, and it shows the causal linkages and factors which affect mental health outcomes, indirectly and directly. A lot of them the direct damage factors act through stress to produce poor mental health outcomes. Some of them act through physical health, through damage to the health system, and through actual direct damage of the flood event itself. So this model is very useful to pick up what are the flood event stressors that are causing negative mental health outcomes. It's mostly about those impacts, and it suggests some response mechanisms that can be put in place to help to mitigate against those event stressor impacts. But it's a very linear model. It doesn't recognise any kind of pre-existing conditions or the effect of repeat flooding. Another useful model is the TAPSIL model, which is a general psychosocial model of flood impacts, not specifically mental health, but specifically flooding. And this model is very useful for thinking about the social and other societal and other factors that impact on and compound with the event stressors to produce poor mental health outcomes. This model emphasizes the cyclical nature of the impacts and so suggests that there is a role for flood memory within the process. But it doesn't explicitly bring memory into it, and it's not an explicitly mental health model. This leads further, these two models and some work by Schultz leads to a categorization of factors affecting mental health outcomes. I skipped a few slides there. Go back. The first slide, factors affecting the prevalence of mental health outcomes categorized into pre-existing conditions such as the history of psychiatric disorder within the population, age, ethnicity, features of the actual event, the severity of exposure, some perceptual aspects of the stressor event, and loss and damage, image, injury, etc. And then the post-event stress and coping strategy aspects, which are about what other stressors people have in their lives, what distresses they're encountering in the community, what social support and coping strategies there are available to mitigate against the effect of the stressor event. There are interesting things about cultural factors, but again, these are not predictive. It's not possible to say from these stressor events or from these factors what will be the level of need in a community following the flood. For example, the socioeconomic and socioeconomic factors and gender are fairly good predictors, as Tierney observed, of mental health outcomes, whereas age, which is something which is often talked about as a predictor of mental health and physical difficulties after flooding, is not so straightforward. It's certainly not a linear relationship with age. For example, some studies have suggested that people of a middle age are worse affected, whereas others have suggested that older age people are worse affected by flooding. Severity of exposure is a fairly confident predictor of mental health aspects or mental health issues after flooding. Certainly where there are financial hardships, severe property damage, where there are casualties, and where there is a perception that there were human causes of the flood. If any two of those severe stresses are present in the event, then the level of mental health issues afterwards are seen to be higher. And some of the post-event stress and coping strategies, again, can be fairly ambivalent in their impact on mental health issues. So, for example, for a spousal support network, it's seen that men get some support and that they are less likely to suffer mental health issues after flood with spousal support, whereas for females, it's more complicated, and that could be down to the fact that they are the ones who are doing the supporting. They're the ones who are dealing with the aftermath of the flood, usually more than their husbands. So moving on to the third question, which is about the length of disaster recovery and the impact of memory on that. So here I'm showing the classic phases of disaster diagram, which many of you may be familiar with, which shows a length of recovery of any time after, and this is generalized for any disaster, 1 to 3 years. It helps to explain where memory might impact upon disaster recovery. Is 3 years a sensible estimate for flooding? Norris suggested that 2 years was a recovery period. Tapsell had a 4-year panel study which showed that, in fact, people were still suffering 4 years after the event, and suggested that for some people they would never fully recover from a disaster event. You can also see there the impact of trigger events and anniversary reactions. So in summary of the duration and memory findings, most of the symptoms from flooding, the milder ones, disappear quite quickly. But quite quickly is anything from 2 to 4 years. For a minority of the population, they last a long time and perhaps will never go away. That memory has an impact on symptoms is demonstrated by the fact that anniversaries of events, trauma events, can trigger increases in symptoms. So remembering an event makes your symptoms more severe. But people that have actually, and there have been few studies that have actually looked at this, but one was by Mason in the UK, and they concluded that actually it's not clear whether flood experience makes mental health outcomes better or worse. So some studies, such as Galileo, have shown that trauma increases that past trauma increases the impact of on mental health, whereas others, such as Norris and Morrissey, suggest that there could be an inoculation effect where frequent trauma or frequent flood experience and flood memory can actually make communities more resilient as they expect and react to the events and become more in control. So that suggests that there could be interventions brought to bear upon this problem, which could move from frequent flooding being a stressful and devastating impact to frequent flooding being something which empowers and inoculates communities against the impact of flooding. And that strengthens the argument for looking at memory, repeat flooding, and recovery processes. But not all influencing factors are affected by memory and experience. So removing from my previous list those things which don't really change, such as gender, dependent upon flood experience, we come up with a shorter list of things which could be impacted by memory within the pre-existing conditions, the features of the stressor event, and the post-event stress and coping strategies. So, for example, here we have a history of psychiatric disorder could be made worse because of the lasting impact of a previous event. That's fairly straightforward, but we also have level of personal property damage and loss, which could be improved by preparedness. So the memory of a previous event could actually make this better, but if preparedness is not improved, then level of personal property damage and loss could be cumulative over the flood event and therefore very much more devastating. Moving on to post-event stress and coping strategies, I talked a little bit about perception that you're in control or that somebody else is in control of this disaster. Some coping strategies might be employed that recognize that blame other people or that make you feel that it's never going to happen again because there was some specific cause. Those may help in recovery. They may make your recovery quicker, but they may have to be abandoned if the experience of frequent flooding shows you that actually it isn't anybody else's fault and these things are going to happen again. So that analysis for each of those particular conditions that analysis for each of those particular conditions leads to a conceptual model which examines the influencing factors, the mitigating factors that could be brought to bear to improve the impact of flood memory and flood experience on mental health outcomes, and the potential combined impact of the impact of flood experience and the possible mitigating factors. And this model takes the 11 factors in my previous table one by one and looks, for example, at level of personal loss, which may not be impacted by flood memory, but could be mitigated by preparedness to bring out a more positive mental health outcome in the future. And just to take another random example, the thought of living with the threat of flood permanently, that could have a very negative effect on communities where there is a repeat flooding, but with the correct counselling, coping strategies and preparedness, this impact could possibly be mitigated with a combination of mental health professionals and recovery disaster professionals and training and preparedness measures. So what are the implications of this model, this framework, if you like, which is not a measurement. It's not a measurement, it's not predictive, it's really indicative of what things need to be considered when dealing with people previously or recently flooded. The implications are that the state of the art in mental health science is not really ready to predict patterns of mental health needs in advance of flooding. That it's important to avoid pathologizing what is a normal reaction to trauma and to recognize those who are most vulnerable, those that need support, and arguing through this, those people who are in a situation where flooding is going to recur or they're in a frequent flood situation, those may be people who are more vulnerable and need more support. Because repeat flooding can be instrumental in triggering more severe mental health disorders if there is no support. I think this analysis helps to identify that any interventions which speed recovery can help to mitigate against mental health disorders, and that we can identify helpful interventions to build adaptive capacity, i.e. to produce better pre-existing conditions before the next flood. And also that it's very helpful to consider coping styles, and particularly for disaster recovery professionals to think about advice to people in flooded communities about how they can adopt the correct coping style in order to take positive actions rather than to feel that they are a victim of flooding. So what's the summary of that? I think the summary is that looking at mental health prevalence through the lens of memory, flood experience and repeat flooding can bring new insights for recovery processes, and that this model should be developed further in discussion with health professionals and recovery professionals to look at ways in which they can identify people and communities that might be vulnerable and provide appropriate support. We're also going to, based on this framework, re-examine some recent survey data that we have within the communities, within the centre, looking at preparedness and anxiety and mental health issues in communities flooding the 2007 event, and from that develop some very specific questions to bring into a new survey of repeatedly flooded communities that we are identifying within the UK. And finally, that we need to discuss these findings with health professionals to validate what is essentially a review of literature across a very broad area, much of which was not based on clinical diagnosis or clinical practice. So are there any questions? Okay, so somebody's observed that my definition of flood exposed presupposes that flood exposed will be labelled as vulnerable. I hope that I didn't give that impression. So what I'm trying to convey is the fact that a flood exposed community can be more vulnerable if no mitigating steps are taken, but that the inoculation effect, which is propounded by some studies, shows that actually those people who are frequently flooded have coping strategies which mean that they may not be very vulnerable in the future. Thank you. I think my definition said changes and not increases. So when my very first definition of memory at the beginning here, the differential level of vulnerability. So that's not implying increased vulnerability, but differential levels. Are there any other questions? I can see that people are typing, but I can't see any questions coming up. That's a very interesting question. What's the relationship between memory and local regional history, and is trauma related to geographical space? So if this inoculation theory about communities being made stronger by a history of coping with trauma is correct, then there should be some geographical basis to that, because these experiences are shared and the memory of these experiences may be shared. They may be contested, of course, that's also true, but I think There's also a pyramid model which looks at people directly impacted, but also the wider community who hear about the impact. And perhaps we have the role of the media as mediator in that kind of building of collective memory. Okay, so thanks, Sue, for that information. It's great to hear because I think, as I said, there's a whole spectrum of research that needs to be done here. Our take on this is very specifically about repeat flooding, but there's a whole, from clinical diagnosis through appropriate treatments, through the recovery process that needs to be done. So I'm glad to hear that. Another very good question about whether it helps to know that a flood is coming, or does it make things worse? I think it was Parker who described the pre-threat anxiety that can come with knowing that there is an event just about to happen, and getting a pre-warning of it. And again, I think that was going to depend on how prepared people are and what their memory of previous events is and the way that they coped with them. So knowing that a flood is coming allows steps to be taken to prevent the worst impacts of it. But if your memory of flooding is bad, then it's going to make you feel anxious before the event. The report, as I mentioned right at the beginning, this is based on a conference paper that I'm going to be presenting in June, and as soon as that conference is over, we will be putting that paper up on the UE Open Repository, so you'll be able to get a look at it. Okay, so does knowledge of a personal flood risk and how to respond to a flood improve people's ability to cope with it? I think that not necessarily the results from this study, but I think that's a generally accepted principle that if you are aware of your risk and you know how to respond, then you are better able to cope with the actual damage. And the findings from most mental health studies imply that if there is a lower level of damage, then your mental health outcome will be better. So I think we can say that that's implied. How can this research be integrated into flood risk management? I think I've tried to indicate that this specific study is about looking at how we can support people in the aftermath of a flood, and my particular interest is in the recovery, is in disaster recovery, and looking at how professionals, both mental health professionals and more general disaster recovery and emergency management professionals, can really learn about coping strategies and good guidance and advice that they can give to people that have been flooded, which will assist in improving mental health outcomes. So I think there are several ways that you could go about this. Maybe there could be some education and guidance for disaster recovery professionals that could come out of this study. Yeah, I quite agree with that statement. So awareness doesn't necessarily produce action. So it doesn't necessarily lead to preparedness for a lot of reasons. And one of the reasons that you don't get better preparedness just because you understand the risk is that you don't feel it's your responsibility to protect yourself. I think one of the things that repeated flooding and flood memory might bring in a positive way to that is that you would learn quite quickly whether or not it was whether anybody else took it as their responsibility to protect you or not. And there's a phrase, 3 times is enemy action. People think that they are not responsible, they think that it won't happen again. But once floods happen quite frequently to people, then they realise that firstly that it will happen again, and secondly that nobody else is going to do that protection for them. And then that's at that point they begin to look for ways to take action. If they are able, if they have the resources, if they have the knowledge, then at that point they're much more likely to take some action. And thank you all for listening and your really thoughtful questions, which I will take away and ponder some more. Thank you.